Smoking and its effects on the perinatal period and birth outcomes of First Nations women in Australia, presented by Sarah Clark. I would like to begin by acknowledging the traditional owners and custodians of this land upon which our university sits. I acknowledge that the Fremantle campus is located on Whadjuk country, and it is a privilege to be on this country. The prevalence of smoking in First Nations peoples. It is known that there are major discrepancies between the health outcomes of First Nations peoples in comparison to Australia's non-Indigenous population. Within First Nations peoples groups, tobacco smoking is one of the most modifiable risk factors that contributes to the discrepancies they face regarding their health outcomes. The act of smoking during pregnancy is seen in higher proportions of First Nations women in comparison to the non-Indigenous population. Statistically, 45 to 55% of First Nations women are reported to smoke during pregnancy, and this is the leading risk factor that contributes to low birth weight babies and stillbirths in the First Nations babies population. Preterm birth, commonly a result of smoking in pregnancy, has been shown to lead to increased rates of SIDS, asthma, and renal dysfunction. It also increases the rate of the need to access healthcare for the infant throughout its childhood. Preterm birth is when a neonate is born prematurely at any point after 20 weeks and before 37 weeks, which is full gestation. Babies who are born from First Nations mothers are 1.6 times more likely to be born prematurely. And when comparing First Nations babies exposed to smoking in utero with non-Indigenous babies exposed in utero, First Nations babies experience greater adverse outcomes to their well-being. This shows that there is negative health outcomes of the First Nations babies isn't only affected due to maternal smoking, but reflects a greater systemic issue relating to the social determinants of health. Diversity of First Nations peoples. Elders hold an important role in the First Nations peoples' families. Their duty is to pass down knowledge, laws, practices, and provide guidance in the decision-making of the preceding generations. The cultural traditions carried out by First Nations people involve the sharing of knowledge regarding childbirth, as well as the involvement of family at birth throughout kinship practices. Birthing on country is a practice carried out by First Nations women, by which they give birth to babies on the same land the mother was born on, or on the land the father was born on, as this fosters a spiritual connection between baby and country. Finally, family members, through kinship, are often very involved in the child-rearing process and assist in raising the child over the duration of their lifetime, starting from childhood. The colonisation of Australia produced a cascade of structural inequities which are still experienced by First Nations peoples today, impacting the care they receive and affecting the birthing outcomes of the women. Smoking during pregnancy is prevalent in greater proportions of First Nations women compared to non-Indigenous women due to the negative influence colonisation had on many social, cultural, and economic factors that are uniquely experienced by First Nations women. Some of these inequities are intergenerational trauma, discrimination, racism, dispossession, marginalisation, geographical barriers, and paternalistic government policy. In addition to these, there are also many negative social determinants of health faced by First Nations people, such as low-income households, overcrowding in homes, and food poverty. 34% of the total health gap between First Nations peoples and non-Indigenous Australians is due to the social determinants of health, and only 19% is due to individual, personal factors. The impact of smoking during the perinatal period. Maternally, exposure to tobacco smoking during pregnancy increases the risk of experiencing miscarriage, ectopic pregnancies, antepartum bleeding, placental abruption, placental previa, postpartum hemorrhage, and altered thyroid function. Smoking during pregnancy can also cause many detrimental effects to the developing fetus in utero, such as reduced birth weight, premature birth, congenital abnormalities, stillbirth, and even increased risk of ADHD. Families can sometimes also be a barrier to prevent the pregnant mother quitting her smoking. This may be due to their judgment, own smoking habits, or the perpetuating of the mother's stress through their relationship. However, on the other hand, family members can encourage pregnant mothers to quit smoking, additionally by quitting themselves out of support. Cultural safety is a model of care that aims to make First Nations peoples feel safe when in the healthcare setting through acknowledging their cultural beliefs, values, and practices, and empowering them while working to eliminate barriers, racism, and the ongoing effects of colonization. Experiencing racism, especially within the healthcare setting, has a negative impact on the health of those targeted by it, and evidence shows there is an association between First Nations peoples experiencing racism and increased rates of smoking during pregnancy. Some changes that should improve culturally safe care are increasing cultural governance of the First Nations peoples, increasing numbers of Aboriginal and Torres Strait Islander peoples in the healthcare workforce, and promoting a more culturally educated non-Indigenous workforce. In 2008, the Australian government introduced a campaign called Closing the Gap. One of the campaign's goals has been to reduce the discrepancy in poor birthing outcomes that First Nations peoples face in comparison to non-Indigenous Australians. Within this was the goal to decrease the incident rate of First Nations babies being born at a low birth rate and to reduce stillbirths. Many strategies have been previously developed and implemented into the care of First Nations women to reduce the maternal smoking rates. However, they fail to be effective as these strategies were not designed with an understanding of First Nations people's culture. When designing strategies for First Nations women, it is vital to consider their cultural beliefs, knowledge, and values, as well as involving the voices of First Nations peoples in the development process. Women who receive continuity of care with the same midwife and who also have the involvement of other First Nations peoples in their care typically receive greater culturally safe care, especially when supported by First Nations midwives. To carry out culturally safe care, midwives should consider the following to eliminate the potential influence of personal bias: fostering cultural awareness, fostering cultural sensitivity, and to carry out culturally safe care that is based on cultural differences identified and work to adapt care to respect these differences. In addition to this, midwives should advocate for increased representation of First Nations peoples in the midwifery workforce, maternity care that is culturally competent, and the development of birthing on country programs. Strategies to reduce smoking that have been successfully implemented with non-Indigenous cohorts have not been found to be effective with regards to First Nations mothers. This highlights the need to develop strategies that are culturally sensitive to the needs of First Nations women. Elder-led campaigns are an effective form of communication at reducing smoking rates. And First Nations women are more inclined to follow recommended health advice when they are encouraged to by family members or elders who are also First Nations as opposed to non-Indigenous practitioners. Therefore, involving First Nations health professionals in the delivery of quit smoking campaigns is the most effective way to reduce maternal smoking rates. And iSister Quit is a resource available to First Nations women, and all multidisciplinary team professionals can also complete training through iSister Quit to ensure the care they provide is culturally informed. When it comes to birthing options available to First Nations women who smoke, the options available to them is dependent on their individual pregnancy and risks. Mothers facing a high-risk pregnancy as a direct result of the effects of their smoking will likely require greater care input from an obstetrician and the multidisciplinary team. There is an emphasized need for First Nations women to be able to engage in self-determination when it comes to pregnancy, birth, and postpartum. This means that First Nations women are equipped and educated to make independent, informed decisions regarding their perinatal period. And this is where it is dire that midwives advocate for the decisions and values of the birthing mother by equipping them to make educated and informed decisions. The following restrictions are still commonly faced by First Nations peoples in regards to birth, limiting their right to self-determination. For example, birthing off country, a lack of cultural safety, travel, isolation, and stress. As midwives, we need to advocate for change to be made so that First Nations peoples no longer have to experience these health disparities moving forward. In Western Australia specifically, we are governed by the Nurses and Midwives Act of 2006, which sets out the legal framework by which the two professions are to be regulated. Nationally, we have the Nurses and Midwifery Board of Australia, who regulate the practice of nurses and midwives, and all registered members are to work within the standards, codes and guidelines to practice to maintain their registration. While these frameworks and policies are beneficial for maintaining a structure for midwives to work within, there is still unfortunately a gap in cultural safety, equity and self-determination of First Nations peoples that needs to be addressed. In order to achieve the target goal set in 2007's Closing the Gap campaign regarding infant mortality, ongoing reform needs to be integrated into these existing frameworks to reduce the rates of First Nations women smoking during pregnancy and the health outcomes that result of this. Attached here are some culturally appropriate resources to share with First Nations women who smoke. Thank you so much for listening to this presentation, and you will see on the next slide my full reference list. Thank you.